everyone. My name is Tiffany Hudson, and I'm an Indiana State University nursing student. And today, my presentation topic is fighting heart disease against all odds. I chose this topic to educate the population at risk, in which the population at risk are those that have a family history of heart disease. After viewing this brief presentation and taking a look at the handout attached, the viewers will be able to briefly describe the process of heart disease by identifying some of the conditions that could affect your heart, identifying 4 or 5 signs and symptoms of heart disease, recognizing ways to reduce the risk of developing heart disease, identifying health screenings, tests, and evaluations that could be performed to diagnose heart disease, state 5 techniques to reduce or relieve stress, and initiate a weekly heart health diet and exercise plan to develop a healthy heart. At this time, take a brief moment to take the pretest before going any further with the video. Thank you. So, what is heart disease? Heart disease is any disease or condition that affects the heart or the blood vessels. The heart and the blood vessels plays a major role in your body. The heart and the blood vessels pumps blood to the rest of your body. Common heart diseases are atherosclerosis, high blood pressure, heart attack, heart failure, arrhythmia, stroke, and heart valve problem. Now, I've got a little skit here real quick. These are your blood vessels, okay? This one has a thin blood without any plaque buildup or any fat or cholesterol, which is called atherosclerosis, okay? So, you see how it flows pretty good? No issues there. So now you have this one. And you have a difficult time getting to the rest of the body. Okay? When plaque builds up, it's called atherosclerosis. Next, we have high blood pressure. High blood pressure is the high force it takes for the blood to go out of the valves of the heart. Heart attack occurs when there is a clot formation in the heart. Heart failure occurs when the heart is simply not pumping like it should. Arrhythmia is when your heartbeat is not normal. Strokes occur when the blood flow to the brain is clotted. When you have a heart valve problem, sometimes you have heart valves in your heart, and sometimes those valves work like doors, and sometimes those are problems or issues occur, and it causes a heart valve problem when they can't shut or close, open or close properly. All right, signs and symptoms of heart disease will include chest pain. Signs and symptoms of heart disease. Some signs and symptoms include chest pains, palpitations when you feel like your heart is racing, difficulty breathing, losing consciousness, also swelling, or if you feel like you can't walk to the mailbox and back without becoming short of breath. Okay, so who is at risk for heart disease? Those with a family history of heart disease are at risk. So here is your family tree. Now here are you. This is you right here. So your family tree. If you have a family tree with heart disease, here's your mom, your dad. The closer you are to these individuals that have heart disease in your family, the higher your chances of developing heart disease. So you really got to be careful, and you have to fight heart disease against all odds. Okay? So, another issues that can cause you to be at risk for heart disease is, starting from the bottom, is poor diet, stress, diabetes, smoking, being overweight or obese, lack of exercise, having high cholesterol, and high blood pressure really increases your risk. So, along with you having a family history of heart disease, but if you smoke or you're not eating properly, you're not exercising, you have a greater risk of having heart disease. So, what's the next step? Your next step is make the doctor's appointment. Make the doctor's appointment, especially if you're having any signs and symptoms of heart disease now or in the past. Make the doctor's appointment, which is very. Next, you need to know your numbers and know the tests. The numbers you should know is your blood pressure. Your blood pressure should be no higher than 120/80 according to American Heart Association. Your cholesterol, you have your good cholesterol and you have your bad cholesterol. Your good cholesterol is your HDL. You want that number to be high because those cholesterols protect the heart. The LDLs you want to be low because those damage the heart. Those store more fat, causing increased risk of heart disease. You also want to know your weight. Your weight and your BMI. Your BMI is your weight and your height calculation. And if your BMI is over 30, you are considered overweight or obese. You also want to know your blood sugar as well. Some blood tests, some tests that can be ran to know where you stand in heart disease is a blood test, EKG, stress test, cardiac catheterization, CT scan, or an MRI. So now you've been to the doctor, you know where you stand, you had all your lab work done, and it comes back perfect. Now, what you do is continue to fight. Be proactive by staying active. 30 minutes per day exercises, according to American Heart Association, can prevent heart disease. Okay? Jumping jacks for a minute, power skips, foot fires, squat jumps, punching, repeating 5 times, only for 30 minutes per day, can prevent heart disease. It's also very important for you to start eating healthy. We're defeating by healthy eating. Okay? So, instead of McDonald's, Kentucky Fried Chicken, or any fast food products, also fried foods, let's try to eat more green leafy vegetables and fruits, making our plate colorful, which is healthy eating, healthy heart diet. Also, salt. Watching your salt intake will also help as well, because wherever salt goes, water follows, which causes your blood pressure to increase and causes you to have heart disease. And I know this one may be tough, but less stress is best. Yes, stress can cause heart disease. So, if it takes you to meditate or yoga, praying, going out more, doing things that make you happy, get rid of the stress. It's very bad on your heart. All right, guys, take this time to do the post test. Again, thank you for your time and patience. Please don't forget to go to the link and download the handout. Thank you.